Okay, so today we're going to break down a condition that I think a lot of us feel like we understand, but it's often a totally silent and unseen emergency, and that's hypothermia. As you're about to see, it is way more common and frankly a lot closer to home than you probably think. When you hear the word hypothermia, what's the first thing that pops into your head? Probably somebody lost in a blizzard on some remote mountain, right? And look, while that's definitely a risk, it is a dangerously narrow view of who's really in danger here. And this slide right here reveals a pretty staggering reality. About half, 50% of all deaths from hypothermia happen to the elderly. And get this, it's often inside their own homes. So this is not just some extreme weather outdoor adventure problem. It can happen to anyone, anywhere. So to really get a handle on the threat, we first have to understand what's actually happening to the body on a physiological level, because it's so much more than just feeling uncomfortably cold. Clinically speaking, hypothermia is a drop in your core body temperature. We're talking about the temperature of your vital internal organs, right? And it happens when that temperature dips below 35 degrees Celsius or 95 Fahrenheit. This is the whole key. It's not about how cold your skin feels. It's about your body losing the battle to keep its internal engine running at the right temp. And as that core temperature keeps falling, the body goes through this really predictable and escalating crisis. You can almost think of it like a three-act drama, where the body's defenses just get progressively overwhelmed. So in Act 1, the mild stage, your body knows it's in trouble, and it is fighting back with everything it's got. The classic sign is shivering. That's just your muscles contracting like crazy to generate heat, your heart rate and your breathing speed up to try and circulate warm blood. But notice that last one, confusion. That's a super early sign that the brain is already being affected. Okay, this is where things take a really dangerous turn. The shivering stops. Now, this is a critical warning sign because it means the body is literally running out of energy. Its main heat-generating mechanism is failing. The heart and breathing slow way down, and consciousness starts to fade. The body isn't fighting anymore, it's starting to shut down. In severe hypothermia, the person can actually appear to be dead. They're in a coma, they have no reflexes, and their breathing might be so shallow that you can't even detect it. The heart becomes extremely unstable, with a crazy high risk of going into a fatal rhythm or just stopping altogether. It's almost like a state of suspended animation, and time is absolutely everything. So when a patient in this state gets to the emergency room, it kicks off this incredibly delicate and urgent sequence of events. The medical team is in a total race against the clock, but at the same time, they have to move with extreme care. The assessment has to be super methodical. They're checking for even the faintest pulse or breath, which, remember, can be really slow and hard to find. They try to figure out what happened, they measure the core temperature with a special probe to get an accurate reading, and they immediately run a whole battery of tests to see what's going on inside. And this just brilliantly illustrates one of the paradoxes of treatment, right? You have to act fast, but you also have to be incredibly gentle, because even simple movements, like rolling the patient over, can jostle their cold, irritable heart and literally trigger a fatal cardiac arrhythmia. So every single action has to be deliberate. These lab tests give them a vital snapshot of the internal damage. They're checking potassium levels, which are critical for heart function. They're ruling out low blood sugar as a cause. They're assessing kidney damage and checking if the cold has wrecked the blood's ability to clot. It's a full diagnostic workup, and it guides everything that comes next. All right, so with a clear picture of what they're up against, the focus shifts to the most important intervention of all, rewarming. But how you do this depends completely on how cold the patient actually is. This right here is the guiding mantra in emergency medicine for severe hypothermia. You see, the cold can actually protect the brain and organs for a while, creating that state of suspended animation we talked about. And what that means is you just don't give up. You keep going with CPR and rewarming until the body's back to a temperature where you can truly know the outcome. So how is it done? Well, for mild cases, it's about passive external warming. Removing wet clothes, piling on warm blankets, and just letting the body warm itself up. But for severe cases, that's not nearly enough. You need active internal rewarming. You have to warm the core from the inside out using things like warmed IV fluids and heated oxygen. And for the most extreme cases, we are talking about a patient in cardiac arrest. Medical teams have to turn to the most advanced technology they have. This is literally bringing someone back from the brink. They use techniques like cardiopulmonary bypass. Yep, the exact same machine they use in open heart surgery. They essentially take the patient's blood out of their body, warm it up in the machine, and then pump it right back in. It is the fastest, most effective way to raise that core temperature and give the heart a chance to restart. So, from that subtle confusion in mild hypothermia to the dangerous silence when the shivering just stops, the signs are there if you know what to look for. This isn't just an issue for mountaineers. It's for our elderly neighbors, for the homeless, or really for anyone who gets unexpectedly exposed. Understanding this process isn't just fascinating science. It's knowledge that could actually help you recognize a true medical emergency.